Hi everyone, hope all of you are doing great. Welcome back. We are going to the chapter which is anaphylactic shock hemodynamics. In this section, we will break down why anaphylaxis causes hypotension, how it classifies as distributive shock, and what happens to the preload, afterload, and cardiac output. So let's begin. Anaphylactic shock is a classic example of the distributive shock, where there is a massive shift of fluids out of the vascular compartment. This is not due to the blood loss, but due to the vasodilation and increased capillary permeability. This increased capillary permeability and vasodilation was caused by the mediators that were released from the mast cells and the basophils. The blood volume is distributed away from the central circulation system. Now, before moving away, let's look at what kind of shocks do we have. So we have four different types of shocks. One is known as the distributive shock, in which there is excessive vasodilation resulting in impaired blood flow distribution to the different organs of the body. Another type of shock is known as hypovolemic shock, in which there is a massive blood loss which results in the decreased volume of the blood, and as a result there is a decreased perfusion of the organs of the body. Third type of shock is known as the cardiogenic shock, in which there is a compromise of the myocardial performance of the heart, which result in reduced output and hence the reduced perfusion of the organs of the body. And the fourth type of the shock is known as the obstructive shock, in which there is obstruction in the filling of the heart. As a result, the ejection into the great vessels is reduced, and hence the reduced output and the reduced perfusion of the organs of the body. So are we clear on that? There are four different types of the shock: the distributive shock, in which there is excessive vasodilation; the hypovolemic shock, in which there is blood loss; the cardiogenic shock, in which myocardial fibers are affected; and the obstructive shock, in which heart is unable to be filled completely by the blood. As a result, there is decreased output. So why hypotension happens as a result of the anaphylactic shock? The histamine and the leukotrienes which were released from the mast cells cause profound vasodilation and capillary leakage. As the plasma seeps into the interstitial tissues, circulating volume would drop and the blood pressure falls rapidly. So the fluid has shifted from the central circulation towards the peripheral tissues, causing the edema of the tissues and the reduced perfusion of the organs. Let's break it down further hemodynamically. So when the preload decreases due to the plasma loss into the interstitial spaces, the afterload also decreases due to the systemic vasodilation. There is vascular resistance is abnormally low and the fluid is leaking out of the capillaries into the interstitial tissues. Now, cardiac output may initially rise reflexively due to the tachycardia, which is the excessive beating of the heart, which is trying to compensate for the decreased volume in the blood vessels in order to maintain the blood pressure, which is detected by different receptors in the body. But the tachycardia, there is no enough volume, so it declines rapidly. The heart rate also declines rapidly, leading to the shock. Now, in order to summarize all of this, anaphylactic shock is a distributive shock in nature, in which there is a shift of the fluid from the capillaries or the central circulation towards the tissues, causing the tissue edema due to the vasodilation and the excessive increase in the capillary permeability from which the fluid is leaking into the tissues. And this is caused by the histamine-induced vasodilation and capillary leak, which cause the decrease in preload, and as a result, there is a low afterload. This leads to the hypotension and reduced perfusion of the organs of the body, especially to the vital organs that were functioning to maintaining all of the functions or the physiological functions of the body. And that's it from this chapter. We will see you in the next chapter very soon. Good luck.